So moving on to the thiazolidinediones, pioglitazone, rosiglitazone, and all those things. It is a PPR gamma activated. So it is a PPR gamma activated. It induces the transcription of the genes involved in glucose and lipid metabolism. What does it do in the liver? It improves the insulin sensitivity, so reduces gluconeogenesis and fat content. So fatty liver is also reduced. Skeletal muscle increases the glucose uptake, and in adipose tissue, since insulin sensitivity is improved, it increases glucose uptake, increase lipogenesis, and increase the fatty acid uptake. So, by using thiazolidinediones, insulin-mediated glucose uptake in skeletal muscle suppresses glucose output and improves the secretory response of insulin in pancreatic beta cell. Hypoglycemia is negligible. At the same time, it has pleiotropic effect. It improves the endothelial dysfunction. Why? Because it increases the insulin. So nitric oxide release would be more, endothelial dysfunction would be improved. It lowers hypertension, improves dyslipidemia, reduces the cytokines. So there are two trials that you will have to know. One is proactive trial. Okay. So in that trial, what they proved is when thiazolidinediones are used, it reduced the all-cause mortality, non-fatal MI, as well as stroke in diabetic patients. Okay. And they noted that, however, heart failure was increased. I told you why. Because it causes a state of volume overload. So, heart failure was increased. Whereas next came your IRIS trial. In that, they found out that in insulin resistant type 2 diabetic patient, even in non diabetic patients with stroke, it reduced the CV outcomes. Okay. In NASH, they have found out it's going to alleviate NASH in patients with pre-diabetes or diabetes. But the main side effect is weight gain. Around 5 kg weight gain you will have, fluid retention you will have, edema you will have, heart failure in predisposed individual, and since it increases the fat generation. So what it does is that it the basic mesenchymal cells, no, chondrocytes, osteocytes, and lipocytes, they can differentiate in any line. What PPR gamma activation does is usually diverts it only to lipogenetic pathway. So inside the bone marrow, lot of marrow fat will start expanding, and the osteal part would be suppressed, and that is the main reason for increased risk of bone fractures in patients with pioglitazone and rosiglitazone usage. Okay.